All right, good morning, everyone. Thank you for joining us today. We're just making sure everything runs smoothly on Teams webinar. And Lindley and Lisa, I'm going to let you, well, mainly Lindley, but if you can see how to turn the lobby sound off, so when someone's joining, we don't get that beep. Okay. All right, good morning. Welcome to the Alzheimer's Disease Research Awards Request for Applications, number 24-10004 Informational Webinar, hosted by the California Department of Public Health Chronic Disease Control Branch, Alzheimer's Disease Program. Before we begin, please note the following reminders and housekeeping rules. This meeting is being recorded. Instructions on the RFA take precedence over any information stated in today's webinar. We will not be taking questions during this webinar. All questions regarding this RFA will need to be in writing and emailed to alzheimersd@cdph.ca.gov. The last day to submit questions is November 9th. Responses to questions will be posted on the ADP Funding Opportunities webpage by November 17th. I will be your host this morning. My name is Tina Fung, and I am the Research and Program Evaluation Lead here at the Alzheimer's Disease Program. Joining me today is the Contracts Manager for this RFA, Feiruz Ahmadi, who will be going over the budget requirements and Q&A. Sorry about that. So the mission of the CDPH Alzheimer's Disease Program is to build awareness of brain health and empower California communities to address Alzheimer's disease and related dementias. ADP is soliciting applications from research institutions to further understand and address the greater prevalence of dementia in underrepresented or disparate populations, including women, communities of color, and populations historically underrepresented in research, including the lesbian, gay, bisexual, transgender, queer or questioning, LGBTQ+ communities, as well as rural communities. Data is needed in these populations to ensure implementation of culturally responsive preventive measures, long-term care services, and support systems at the community level. ADP prioritizes disparate groups that are at greatest risk for ADRD and the associated negative health outcomes from comorbidities due to being underserved, underinsured, and historically underrepresented in research. The objective of this RFA is to fund applicants focused on improving the breadth of research and quality data on California's diverse communities and to accomplish the three following goals. Number one, to bolster ADRD data among disparate groups by either increasing data collection and building upon existing evidence of ADRD prevalence in populations historically underrepresented in ADRD research, or disaggregating data for misrepresented populations such as Asian Americans and Native Hawaiian Pacific Islander populations. Number two, assess the frequency of utilization of ADRD existing services by the populations of focus. And number three, continue outreach of existing ADRD resources and services to impacted and underrepresented populations. Applicants are invited to submit research applications that focus on understanding and addressing the greater prevalence of dementia in women, ethnic minority groups, and/or populations historically underrepresented in research, including the LGBTQ+ communities and rural communities. For reference, the maps in Appendix 5 show each race's population size by county in California. Applications must include a scope of work that focuses on populations suffering from health disparities. Applications must demonstrate research that can help ADRD researchers, ADP, and other audiences identify and understand upstream determinants of health that result in disproportionate health outcomes and prevalence of Alzheimer's disease and related dementias among California's diverse population. Please review examples of this topic area on page 6 of the RFA. In addition to topic area 1, applicants may select one or more of the following topic areas. Caregiving. Applicants can do this by exploring the economic and social impacts of caregiving. Prevention, by focusing on the identification of risk factors and targets for preventive healthcare and public health messaging. Early diagnosis and detection. This can be demonstrated through research and evaluation of tools for early diagnosis and detection of Alzheimer's disease. And lastly, applicants may choose to investigate pathways for reducing disparities in access to health services for persons with ADRD, utilizing long-term services and support systems or health services. You can review examples of these topics on pages 6 and 7 of the RFA. Applications may be submitted for one-time grant funding over 4 consecutive fiscal years. The number of awards issued will be dependent on available funding. We anticipate that grants will be awarded beginning July 1st, 2024, with the grant term ending on June 30th, 2028. Two categories of funding are available: individual investigator awards and consortium research awards. Applicants may apply in one or both categories. However, an applicant that applies in both categories will only be funded for one category. ADP will make the final determination of the awards. In the individual investigator award category, grants awarded of up to $500,000 per project per fiscal year may be funded. Award dollars are inclusive of all costs. Consortium research awards, in this category, grant awards of up to $1.2 million per project, not per institution, per fiscal year may be funded. Award dollars are inclusive of all costs. These grants may be awarded to an institution for a research project performed through a collaborative, formalized agreement between the grantee institution and 2 or more participating institutions. The grantee must have a leadership role in conducting the planned research and not merely serve as a conduit of funds to another party or parties. A letter of commitment from all parties must be included in the grant application. Applicants are expected to detail proposed collaborations as part of the grant application. The scope and nature of the proposed research should clearly demonstrate the value of a collaborative multi-site project for successful execution. Applicants shall include letters of commitment from the participating institutions that describe the activities for which the participating institution will be responsible and staffing commitments as applicable. California public or private nonprofit academic institutions are eligible to apply. Applicants and all other associated co-applicants and subrecipients must be nonprofit and California-based, and all relevant project activities must be taking place in California. Academic institutions and principal investigators participating in a consortium research award are also subject to these requirements. Investigators must be eligible to hold principal investigator status at an academic institution in the state of California, if applying as an academic institution. Applicants who have previously received awards from ADP are eligible to apply for new research projects. Applications in each award category must meet RFA submission requirements and deadlines. Each application will be evaluated on a competitive basis using a standard scoring tool. Applications that do not adhere to these requirements will not be considered for funding. Submission of a non-binding letter of intent to notify ADP of the applicant's intent to submit an application is required. A letter is due by November 13th, 2023 by 5 p.m. Pacific time. The letter of intent must be emailed to alzheimersd@cdph.cea.gov. Applicants that do not submit a letter of intent by the deadline will not be considered for funding. The letter of intent is to be submitted by the applicant on their institution's letterhead and must follow the guidelines provided on the RFA. So now I'm going to switch. I'll be sharing the RFA on screen, so please follow. You can also follow on your own copy starting on page 12 for the application requirements. For the application requirements, applications must consist of full completion of the following documents. The project application face sheet. All applicants, whether individual or consortium, must complete document A of the application in Appendix 2, which will provide ADP information about the applicant. For consortium applications, consortium applicants must complete document A1 of the application, and please include letters of commitment from all collaborating institutions and attach that to A1. Failure to include the letters of commitment will be viewed as non-responsive and the application will not be considered for funding. Next is the project summary. Applicants are to provide a summarized description of the project, list all proposed staff and consultants who will be engaged in the research, and describe their duties and qualifications, indicate the staff's percentage of time's involvement to be funded by this RFA award, and describe the management plan to oversee the project. The next part of the application is body of proposal, research strategy, which must include the following 3 sections. The first section is the specific aims, which applicants will need to describe concisely and realistically the short-term and long-term goals of the proposed research, summarize the specific objectives and hypotheses to be tested, and summarize the expected outcomes and the impact of the proposed research on the research fields involved. The second section of the body of proposal is significance, which needs to include a narrative response that describes the following. The significance section needs the population or populations of focus, county or counties where research will be conducted, justification for populations selected within supporting data, the importance of the problem or the critical barrier to progress in the field that is being addressed, the state of existing knowledge, including literature, citations, and highlights of relevant data, and if applicable, the principal investigator's preliminary studies, data, and experience relevant to the application, and the experimental design. This section also needs to include the rationale of the proposed research, explain gaps the project is intended to fill, and also the significance of the proposed research and relevance to public health, explain how the proposed research project will improve scientific knowledge, technical capability, and/or clinical practice in one or more broad fields. Describe how the concepts, methods, technologies, treatments, services, or preventative interventions that drive this field will be changed if the proposed aims are achieved, and how the proposed research project can contribute to eliminating disparities and improving health equity. And the last part of this section is innovation, which needs to include needs to include an explanation of how the application challenges and seeks to shift current research or clinical practice paradigms, describe any novel theoretical concepts, approaches, methodologies, instrumentation, or interventions to be developed or used, and any advantage over existing methodologies, instrumentation, or interventions. And lastly, explain any refinements, improvements, or new applications of theoretical concepts, approaches, methodologies, instrumentation, or interventions. The next part of the application is the approach and project activities. For the approach section, discuss the approach to the research and include the following information: the purpose, describe how the research will be carried out, the research design and methods. The section must include the following: the overview of the experimental design, description of methods and analyses to be used to accomplish the specific aims of the project, discussion of potential difficulties and limitations, and how these will be overcome or mitigated, and expected results and alternative approaches that will be used if unexpected results are found. For the project activities, provide a timetable with specific milestones, include deliverables that will be submitted with each progress report. Deliverables are tangible things that will be produced to demonstrate the achievement of each activity. And after that is facilities, equipment, and resources. In this section, applicants are to describe available facilities, major equipment, and resources. Describe the scientific environment and institutional setting in which the proposed project will be carried out. And with the budget, I'll hand it over to Feiruz to review the budget section.
Thank you, Tina. Good morning, and thank you for joining us this morning. About the budget requirement, there is.
Let me. Oh, sorry. Go ahead.
Yeah, can you hear me now?
Yep.
About the budget requirement, please refer to Appendix 3, which is attached on the web page separately. It's the Excel workbook titled Appendix 3 Budget Template, which has a few sections starting from section A to D. The section under section A is for personnel. Please put list the name, project role, and the level of efforts of the personnel who will be involved with this project, is starting from the principal investigator. And also use on the bottom of this section, you may use the fringe benefits. For the travel, yeah, please use the section B under the operating expenses that you may intend to travel, whether it is related to this project, whether this is a training, a webinar, an evaluation, or a conference. You may request budget in the travel section. On material and supply sections, you may request under the office consumable supplies such as pen, pencil, paper, copier, and etc. Under the equipment, you may request budget if you intend to lease an equipment for this project. And on the under the cost and sub awardee, you may request the cost. Sorry. For the sub for the other for the sub awardees, for the sub awardees, please use the section D of the appendix 3. If you intend to have any sub awardee, please use this section under the other direct cost. And at the same time, if you have the sub awardee also should fill out the exhibit B2 entitled the sub awardee budget template need to be submitted with the application. For the other direct cost, which is related to the scope of this project but not listed under the operation expenses, you may use also add them under the other direct costs, which could be lease. You may lease any spaces, libraries, conferences, break room. It is still like that. If you need any budget for that, please also use the section D. For the indirect cost is please also use and on the indirect cost on the section D. The indirect cost is usually the management cost, which is not related directly with the scope of the project, which include accounting, budgeting, maintenance, data processing, etc. Yeah, this is on this section. Please fill out with the indirect cost. The indirect cost under this RFA is 40% of the total budget. Thank you, Tina. Back to you.
Great, thank you, Feroz. For the application submission, submit the application packet as detailed above under Part 2, Application Process, Section B. Submit the application with the exception of the budget in Word document format and send to Alzheimer's D at cdph.ca.gov. RFA packages must be received by December 15th, 2023 by 5 p.m. Pacific time. And ADP will send a confirmation of receipt of the application packet to the applicant via email. In the first phase of application reviews, ADP will carefully screen all applications received by the due date for compliance with all requirements stated in the RFA. Only fully completed applications will be considered eligible and advanced to the review committee. Non-responsive applications will not advance to phase 2 of the RFA. Applicants will be notified that their applications did not meet eligibility and or published submission requirements. Applicants that move to phase 2 will not be notified. Applications satisfying the requirements set forth in this RFA will be forwarded to the review panel in phase 2 of the review. Please note that reviewers will not be required to review application beyond maximum number of pages. Reviewers will employ a scoring tool based on the RFA requirements. Applications with the highest scores will be considered for funding. The rubric is valued at a maximum of 100 points. Table 2 outlines the maximum point values for each section, and Table 3 details the point breakdown for each application component. To be considered for funding, a minimum of score of 75 is required. The department reserves the right to request clarification or supplemental information from the applicant. In phase 3, applications will be funded in order by score and rank determined by the review committee. When selecting awardees, the review committee will consider requirements along with any factors that may affect the funding rank order and decision. Applicants may be funded out of order to ensure target population representation of recipients is non-duplicative, and to ensure that the breadth of opportunities across groups highly affected by ADRDs in the area served are maintained through this RFA. The applicant should explain the different types of consequences, such as how many people have ADRDs, populations most likely to have ADRDs, or health consequences related to ADRDs in specific populations. Upon completion of the grant review process, a notification of acceptance will be posted on the Alzheimer's Disease Program Funding Opportunities webpage. Final posting of selected awardees will be posted to the same webpage. The scoring includes each component and the maximum points associated with it. For more information on the scoring criteria, please refer to pages 15 to 17 of the RFA. Following the review process, grant awards will be negotiated between the successful applicant, institution, and ADP. Grantees will be required to conform to CDPH's contractual requirements and standard state provisions and restrictions included in each grant. ADP may require modifications to the application components, such as the scope of work or detailed budget, as a condition of the award, which will become part of the final grant. Upon completion and approval of these documents, the grant documents will be submitted to CDPH for execution. Part 4 describes the administrative requirements, which discusses major grant provisions and restrictions for funded grantees. Please refer to this section starting on page 21 for specific details. This concludes the discussion of the RFA requirements. We will review submitted questions next, but first we would like to share some reminders. Please refer to key dates on page 10 of the RFA for upcoming deadlines and review all RFA documents, including appendices. ADP advises you to check the ADP Funding Opportunities webpage frequently for updates in the event that ADP needs to modify any date or deadline appearing in this RFA or issue clarification notices, addenda, alternate RFA, instructions, forms, etc. If this RFA is clarified, corrected, or modified, ADP will post all clarification notices and/or RFA addenda on the ADP Funding Opportunities webpage. Again, we will not be taking questions during this webinar. All questions regarding this RFA will need to be in writing and emailed to alzheimersd@cdph.ca.gov. The last day to submit questions is November 9th. Responses to questions will be posted on the ADP webpage by November 17th. And again, instructions on the RFA take precedence over any information stated on today's webinar. To view this recording and the documents for this RFA, please visit the California Department of Public Health Alzheimer's Disease Program Funding Opportunities webpage. And now I will turn it back to Ferouz to go through the Q&As that were already submitted and to provide answers.
Thank you, Tina. These are the number of the questions that we have received so far. As mentioned by Tina, the Q&A is still open. If there's any question, you're most welcome to submit your questions. So we address those questions we received so far. The question is, the total cost of an individual Oops, Tina, I lost your screen. Oh, thank you. The total cost of an individual investigator award is $500,000 per year. What is the allowed indirect cost rate for the University of California? The answer is the indirect cost rate is 40%, and the total dollar amount for each fiscal year includes both direct and indirect costs. For further details, please review Appendix 1, Application and Instruction, Document F, Budget Justification. Next slide, please. Question is this funding restricted solely to academic institution? And if so, what is the rationale for this restriction? The answer is no. Funding from this RFA is open to organizations that have the capacity to conduct research as described in Revenue and Taxation Code 18761, Section H. Most organizations in the conduct research are academic institutions, but not all. Next slide, please. Question is, the RFA under Section C available funding categories of award. Subsection 2 Consortium Research Award use the wording institution, granting institution, and participating institution. What entities qualify as this institution? The answer is grant may be awarded to a consortium which is defined as a research project performed through a collaborative formalized agreement between the grantee institution and two or more participating institutions. The grantee institution is the primary awardee that has a leadership role in conducting the planned research and distributing funds to participating institution, otherwise known as a partner or collaborating organization. In a consortium contract, the participating institution or collaborating organizations are subcontracted with the primary awardees, also known as the grantee institution. Next slide, please. Question is, on Table 1, key dates, the letter of intent is due on November 17, 2023. A waiver on the letter of intent requires section. The due date is November 9. Please clarify the due date. The answer is the letter of intent is due to ADP on November 17, 2023 at 5 p.m. Pacific time. Please email letters to alzheimersd@cdph.ca.gov. Question is, we will study California Alzheimer's disease in dementia patients. We will also study the US database. Is it okay to study patients outside California because the goal is to increase the sample size? The answer is yes. You may use database that study patients out of California if you can provide justification in your application that using this database would address the mission, goal, and objectives of this RFA. Question is, are there any restrictions or preferences on the research methodology or approach? Are there any guidelines or preferences on the scale of the study, example, e.g. sample size? The answer is no. This RFA does not have restrictions or preferences on the research methodology and approach. Nor does it have guidelines or preferences on the scale of a study. Application scores will be based on criteria described in Table 3, point breakdown for each application component, starting on page 17 of the RFA. Yes. Question is, the face sheet indicate the award term is 1 to 2 years because the RFA is for 4 years. Project, may I change the form? The answer is yes, you may change the form. You can request up to 4 years. The question is section 6, 7, 8, 9, 10 of page 3 and 4, the city, state, and zip code misaligned when attempting to input information. Are we allowed to reformat the application to fix this? The answer is yes, you may reformat the form. Question is document D, is the project activity timetable with a specific milestone included in the 15-page limit? The answer is yes. The project activity timetable with a specific milestone included in the 15-page limit. The question is, we notice that all flammable sections are in blue. Would you like all these sections to be remain in blue? The answer is text can be blue or black.
Great, thank you, Feiruz. Those are all the submitted questions. This concludes today's informational webinar for RFA 24-10004. We thank you for your attendance. Have a great weekend, everyone.
Thank you.